Hello friends, welcome to Dr. Ossai Physiology Academy, DOPA for short. This is the place where we make the learning of physiology easy, exciting, and effective. Thank you for joining me. If you're new to this channel, you're especially welcome. And if you love the content that we share, kindly click the like button and also the subscribe button. Don't forget to turn on notifications so that you don't get to miss any new content that we drop. Now let's get started. So we're entering the part 2 of thyroid hormones. And now we're going to be talking about the physiological functions. And it's very easy to understand. Thyroxine, thyroid hormones, they enhance almost everything. Enhancement of all the functions. They affect all the cells of the body. And one of the things, if there's anything you should not forget, is the fact that they increase what? Basal metabolic rate, BMR. That means the rate at which your body does work, the rate at which your body produces energy, all the chemical reactions, the rate, it increases the rate of all chemical reactions in the body. That's why I said it enhances virtually every process, physiological process in the body. Okay, but what we're going to be doing, we'll just select some systems and just see the result. Then we'll now talk about briefly about the regulation. Very easy stuff. All right. So now it increases basal metabolic rate. Let's start from the head, the CNS. What's the function? How does the thyroid hormone influence CNS? It influences it especially in the early infancy period. If I call it perinatal period. It's involved in enhancing intellectual, mental, brain development. Okay? Enhances brain development in the perinatal period. Perinatal period is just talking about the period shortly after birth, newborn, a few weeks, few months old. Okay, and that's why babies that have congenital deficiency of thyroid hormone, what do you see that happens to them? Mental retardation. They are mentally retarded because their brain cannot develop well because thyroxine is lacking. T3, T4. All right. So that's what congenital means, from birth, absent from birth. So that's the effect on the CNS effects. Now, okay, what of ANS? That's autonomic nervous system. ANS. It's not well defined, but generally it enhances ANS activity, especially the sympathetic branch. That's why excess thyroid hormone secretion mimics excessive sympathetic stimulation. For example, excessive sweating, excess hyperactivity, increase in blood pressure, heart rate, and all. You understand? Force of contraction of the heart, and all of that. So it also promotes this, actually the sympathetic part, enhance the activity of the sympathetic nervous system. Okay, so now another thing we need to talk about is bones, and this has relationship with growth hormone. There's a special relationship thyroid hormone have with growth hormone. They act synergistically. In other words, thyroid hormones, they are required for the normal synthesis and secretion of growth hormone. Okay, so let's write it here. Enhances synthesis and secretion of growth hormone. So another thing you find out is that children with congenital deficiency, also apart from mental retardation, they are dwarfed. So it also results in dwarfism. So they call them cretins, cretinism. They are mentally retarded and they are dwarfed. They don't grow well. because of this relationship it has with growth hormone. Growth hormone cannot function well without thyroid hormones. Okay, so the next thing, let's look at some of the metabolic effects on protein, carbohydrate, fats. Let's look at it. Now, on proteins, it has very funny effect. It enhances both the synthesis and breakdown of proteins. But here's the trick. When it's in normal levels, the synthesis overrides. Okay, so when thyroid hormone are in normal levels, more of enhancement of synthesis of proteins. And of course, you know that growth hormone has a lot to do with protein synthesis, so you can understand it. Then when it's excess, it is the catabolism, breakdown of proteins that overrides. So on proteins, both synthesis, okay, then breakdown. Then what about carbohydrates? Carbohydrates, it enhances the utilization, availability of glucose and utilization of glucose. Everything is enhancement because it needs to power, it needs to provide energy to power chemical processes in faster rate, basal metabolic rate. So glucose is needed, oxygen is needed. Okay, so that's how it operates. It increases, enhances utilization of glucose. Okay, that's it. So it's involved in glycogen breakdown so that glucose will be available and then glucose will be utilized. That's that. Then what about fats? How does it affect fats? This is how it breaks down fats. That's lipolysis. And that's why those with excess secretion of thyroid hormones, what happens to them? They are slim, thin, they lose a lot of fat. Okay? It enhances breakdown of fats. Now, let's now go to some important systems, cardiovascular, respiratory. It's very easy. It enhances what? Ventilation, pulmonary ventilation and oxygen consumption. Okay? Then when you now enter the cardiovascular system, it enhances heart rate, increases heart rate and force of contraction. So you see everything about it, it's very easy to understand everything about it. And when you talk about the blood now, it enhances erythropoiesis, that's the process of production of red blood cells. Okay? It enhances the production of red. It's one of those general factors that are required for erythropoiesis. Okay? So here, enhances erythropoiesis. Okay? Increases heart rate and force of contraction. Right? Then also the respiratory, as I've mentioned. It increases pulmonary ventilation. Increases pulmonary ventilation. Alright, so basically this is what you need to know about the functions, physiological functions of thyroid hormones. So after this break, we're going to be talking about the regulation and also be shedding some light on thyroid disorders, goiter. You've heard about goiter. We're going to be talking about that after this break. Right, you're welcome back. So now we're going to be dealing with the regulation. Very easy stuff. There's nothing difficult about it. So thyroid hormones, like you know, first of all, they need to be stimulated by thyroid stimulating hormone. And before the thyroid stimulating hormone, you also have a higher control, which is TROH, thyrotropin releasing hormone. Okay, stimulates the pituitary, the thyrotropes there to release thyroid stimulating hormone, which now stimulates the thyrocytes. Thyrocytes. All right. So, but do you know what? The main point of regulation is between this and this, between the thyrocytes in the thyroid gland and then the thyroid stimulating hormone, through a simple negative feedback mechanism. Okay, so when thyroid hormones are getting high in the blood, they inhibit further release of this. When it's getting low, this one is stimulated, and of course with the aid of this. But now we say these two are the major things, but this is where this one is very important. From the functions of thyroid hormones, we know that it's to increase basal metabolic rate. All the reactions, it affects all cells for them to make the reactions faster, metabolic reactions in the body, which are the basis of physiological functions and processes. So now, why it needs the involvement of the brain, this is from the hypothalamus part of the brain, is the fact that there is something else that can stimulate thyroid releasing hormone, and that thing is cold. Okay, cold. It's part of what can stimulate the thyroid releasing hormone to be released from the hypothalamus. And of course, you know that the hypothalamus is the center for temperature regulation. So they go hand in hand. So now the hypothalamus has sensed that there is cold, and when there is cold, it depresses metabolic reactions in the body. Enzymes are not as active. Cold generally slows down chemical processes. So because of that, the solution to it is to release more thyroid hormones to hasten up chemical processes, which in itself will now generate more heat. The more the reactions using energy, the more they liberate heat. Okay, energy in the form of heat, and then the body temperature comes up. So cold is one powerful stimulant of thyroid releasing hormone that goes then, stimulates this, and so on and so forth. Right, so quickly let's go to thyroid disorders. Thyroid disorders. Now, you cannot talk about thyroid disorders without talking about goiter. I'm sure you've heard of goiter before. Let's write it here. Goiter. Goiter. Okay, goiter is swelling of the thyroid gland. But the interesting thing about goiter is the fact that both overproduction and underproduction can manifest as goiter. Now you ask yourself, how can both hyperthyroidism and hypothyroidism resulting in goiter, the swelling of the thyroid gland? This is how it happens. The most common cause of hypothyroidism is iodine deficiency. Okay, iodine deficiency. Though in most developed world, in the developed world now, they now learn to add iodine to salt, called iodized salt. So right now it's uncommon, but in so many other parts of the world where the soil is lacking in iodine and they are not iodizing their salt, you see a lot of goiter, iodine deficiency. And how does it result in goiter? Now the body is sensing that, because without iodine it can't make thyroid hormones, and the body is sensing that thyroid hormones are not sufficient, or we need more. So it's now sending a signal. Okay, it's low, so it's stimulating, sending a signal. This one is being released more to stimulate the thyrocytes to try and produce more. This thing is lacking. become more active. So there is overstimulation of the thyrocytes, and because there's increased demand for them to produce, they grow in size to meet up with the increased demand and stimulation. Okay, so they enlarge, but because the real raw material is not there, even with that enlargement, and there's still deficiency, goiter, enlargement. You see how the now the hyperthyroidism, what could cause it? The most common cause is what is known as Graves' disease. Let's write this one here: iodine deficiency. The most common cause of this. This one, the most common cause, is what is called Graves' disease. Graves' disease is an autoimmune disorder. Autoimmune is your own immune cells are attacking your cells. Your immune cells are attacking self. So when they attack the thyroid gland, it now stimulates it to begin to secrete a lot of thyroid hormones. Okay, so sometimes even in this Graves' disease, there can be no goiter. So it's not every time there's hyperthyroidism that there's goiter. You could have hypothyroidism without goiter. Okay, but when you have hyperthyroidism and goiter, it's when now there is a tumor in this thyroid troops. Okay, at this level you have thyroid troops. A benign tumor. A benign tumor means it's not cancerous. So you have the tumor there producing excess thyroid stimulating hormone and overriding the negative feedback mechanism. So these ones are now excessively stimulated even without thyroid hormone being low, but it's still stimulating. Normally the stimulation in this part is that there is low thyroid hormone, so it's being stimulated. But this one, thyroid hormone is normal, but because there is a tumor there that is now secreting excess, okay, it now stimulates the thyrocytes to begin to produce increased demand, and there's raw material, so it now produces excess. Okay, that's where you have hypothyroidism and goiter at the same time. You understand that? But this Graves' disease is autoimmune disorder. Another thing is that there's also another condition that can start as hyper and then end up as hypo. In the case of thyroiditis, that's inflammation. Thyroiditis. Okay, inflammation of the. So when they are inflamed, you know, thyroid hormones, they are stored in secretory vesicles. So inflammation will now make it to leak out. Do you understand? It will puncture inflammation. They will now leak out and become excess in the bloodstream. When they finish leaking out, they will now be lacking. Hypo. All right, let's not go too much into that. You learn that in medicine, pathology, and all of that. So what are the symptoms of hypothyroidism and hyperthyroidism? From the functions of thyroid hormones, you can easily know that. Now, during hypothyroidism, they are sluggish. People that are lacking in thyroid hormones, hypothyroidism, they are sluggish. Okay, because metabolic rate has reduced. Everything in their body, all chemical processes in their body are slower. So everything, they are sluggish. Okay, so you see here, they are sluggish. Another thing is that they are fatter than normal. Okay, they have increased store of fat. You know that thyroid hormones, lipolysis, they break. So when it's lacking, you accumulate more fat. Okay, so accumulation of fat. Okay, so they can even progress to being obese because of lack of thyroid hormones, and so on and so forth. So everything about them is just slow, sluggish, accumulation of fat, and also the fact that they don't have enough thyroid hormones. they have cold intolerance. So another one here, cold intolerance. Cold intolerance. What does it mean? It means that they enter into an environment that is a bit cool. Other people are still normal, but them, they can't tolerate even that small coolness, because thyroid hormones are not there enough to produce heat. Metabolic reactions are not fast enough to produce heat, so they easily feel cold. That's what's happened. So in this place, it's just opposite. Okay, here you have, they are hyperactive. Okay, they have nervousness, very anxious, anxiety, nervousness. They are also thin. They can be slim or thin. Okay, then also, and I have what? Heat intolerance. And you could also have them having bulging eyeballs like this. You see the thumbnail, right? The thumbnail like this. It's representing hyperthyroidism in goiter. Bulging eyeballs like this. Okay, but in the hypo, rather than bulging, there's puffiness of the eyes. Okay, this one comes out like this. Why they don't almost go, because of that puffiness covering the eyes, like there's so much fat around puffiness of the eyeballs. So that's the difference. So that's what bulging eyeballs, bulging eyeballs. Okay, so basically that's what you need to know about thyroid regulation here. Then disorders, hypo symptoms, and common causes: iron deficiency, Graves' disease, thyroiditis. All right, so I'm going to see you in the next video.